the different healthcare systems that share their outcomes are willing to share them, and then we exploit the differences in the outcomes so that the places that aren't doing well in one area go to the other places and say, what are you doing that we're not doing? Please teach us.
I can feel there's something moving a bit faster at the moment, it feels good.
The people in the system where you're getting care, what are your outcomes? What are you doing to get better outcomes as a system? All right, what are you doing anything? And have you heard about this network that they're really doing everything they can to try to see if there's a way to get better outcomes? Every visit is a learning opportunity, and we share it so that we can all take a look and go, how's it working? And it's saying, hey, look, we have this proportion of people who are doing well. Great, that's terrific.
Andrews, thank you so much for joining me today. I've been following your work, especially what you're doing at the Dalton Family Center and the Bipolar Action Network. And I just want to talk about bipolarity here. So I'm Clément, founder of Upstage and Bipolar Type 2. And I really want to understand about bipolar research and what gives hopes to the future. But I will just jump straight on it. So can you present yourself, Andrew?
Sure. I'm Andy Nierenberg. I am the director of the Dalton Family Center for Bipolar Treatment Innovation at Massachusetts General Hospital, and I'm a professor of psychiatry at Harvard Medical School. I'm also the director of the Bipolar Action Network, and my team at the Dalton Center has a broad array of research to try to improve the lives of people with bipolar disorder, ranging from collaborating with people who are doing basic research all the way to healthcare system change and everything in between.
So one thing we're wondering as bipolar is we always have hope in certain things and then it work out or it don't work for us. What do you hope? What is your hope actually? What do you think is gonna change our life?
So I think several different paths may actually lead to improvement. Starting from the basic science, there's a very interesting science fiction-like movement where you could take any cell in your body, deprogram it, turn it into any other cell you want, and people are doing that to make small 5 millimeter balls of brain tissue, essentially. They're called brain organoids. And the brain organoids retain a lot of the qualities of brains so that you have synapses that are active, you have metabolism, and there's a way to keep the cells alive for a very long time. So we're able to grow the brain organoids from people with bipolar disorder, compare them to people who don't have bipolar disorder, look at what genes get turned on, what proteins get made, and what we're trying to do is understand if people respond to lithium, how do their brain organoids respond to lithium? If they don't respond to lithium, what happens when you expose the brain organoids to lithium? Really, in many ways, trying to understand how does lithium really work? Because we don't know. We know what it does, but we don't really know how it works. So that I think there's hope in better understanding the basic biology of bipolar disorder. At the other end of the spectrum, as I mentioned earlier, with the Bipolar Action Network, we are trying to improve the whole system of care. And the logic model of that is if we improve the system of care, we will improve outcomes. And in many ways, it's a radical collaboration across multiple healthcare systems where the healthcare systems agree to share their data. But the most important thing about the Bipolar Action Network is the culture that we've built, because without the culture, it doesn't work. And the culture is one of humility, generosity, openness, transparency, a willingness to learn, a willingness to teach, and a desire to always do better. And because we have this culture, what happens is that the different healthcare systems that share their outcomes are willing to share them. And then we exploit the differences in the outcomes so that the places that aren't doing well in one area go to the other places and say, what are you doing that we're not doing? Please teach us. And then we could get it better. And in this journey, we've unearthed all sorts of problems with the system. System generally doesn't do systematic diagnosis. The system generally doesn't measure how things are going. The systems don't share what the outcomes are. So you can't even go to a place and say, hey, what are your outcomes? How are people doing in your place? And we've never known before. So we're just starting to learn all of that. The other thing is also crowdsourcing for problems, for discovery. And one of the unique things about the Bipolar Action Network, and it's called a learning health network, is that anybody in the network can act. And in fact, we have people with lived experience, experts by experience, who are doing projects. And you don't need permission, you just do them and communicate. So we're really excited about the potential to get better outcomes using this as a structure. Um, in between, we're doing clinical trials, but we could talk about that separately.
Now that it's a lot of things which is like complicated as a patient, just because like from my point of view, so when I was diagnosed, it's about, I would say, 10 years after my first depression, I was a bit lost. Like, I was asking myself all these questions, and one of them is like, should I take treatment?
Right.
Because, yeah, you're like, oh, maybe I try without it. And then usually you take your treatment. I take my treatment every day. But what would you say to people? Because I feel it's kind of difficult to find the right one. And the usual system to find the right dosage, to find the right molecule. What can we do as patients to help our psychiatrists to find the right one with us?
Well, I think part of it is, um, clearly communicating what side effects that you might have, whether you feel it's getting better or not. And if the person or people who are treating you are not measuring how you're doing, you can measure it yourself, right? And present them with data. There are a lot of apps and other things, to be able to do that. Um, and the field itself is trying to get to the holy grail. Can you match patients to treatments? Can you say, this is the treatment for you, right? Either based on biology or clinical or, whatever. We're really working hard at that. And in fact, we're running a study comparing different treatments for bipolar depression. And to my surprise, it's never been done before. Nobody's ever done it. So it's a very large endeavor, and I hope we are able to get continued funding to do it. But I'm telling you this for a reason, and the reason I'm telling you this is that if we're able to successfully do this study, at the end of the study, what we think we will be able to do is calculate something called an individualized treatment rule. And with an individualized treatment rule, for any individual, we can calculate the probability of responding to any one of the four treatments that we're comparing. And that we think will really be helpful to people.
Maybe it'd be interesting to know what are the four treatments that work actually.
So, so, so the four treatments that we're comparing is a combination of an antipsychotic and an antidepressant. So we're looking at aripiprazole versus escitalopram. We're looking at quetiapine, lurasidone, and cariprazine. Now, the interesting thing about the choices that we made and got funded for is three of those things are approved by the FDA for bipolar depression. The combination of aripiprazole and escitalopram is not. But the combination of fluoxetine and uh, and Zyprexa, olanzapine, that's approved. And it turns out that a lot of people don't like taking olanzapine because of the weight gain, metabolic problems that happen. And so what's commonly done is people assume that the combination of aripiprazole and escitalopram will be just as good, but it's never been tested. so so we're saying, hey, look, a lot of people are doing it. Maybe we should know if it works. That would be nice. So
Yeah.
that's why we got those particular four.
Okay. Yeah. No, but it's really like, because in one way it's like research is so important, but on the other way, when you're in the field and you see all the problems that exist, sometimes it's like it's a little bit far away, but it's why we have hope. And one of the things I really believe in is it could be tough if you're listening, and I've been depressed a few times, and yeah, I can tell it's tough, but I can feel there's something moving a bit faster at the moment, which is, it feels good. And so you talk also about the Bipolar Action Network. I would like to understand a little bit more, because I feel like in most of the country I've been, the system isn't made for mental health. It's usually made for physical health. And then we kind of copy past and we're like, oh, it's not working. But yeah, but it's not the same thing. So what are your recommendations? And because as patient, when we go into like a system, like we try to choose, let's say, an hospital or even a practitioner, what should we think about finding the right fit for us?
So I think part of it is, and I do a lot of consultations, and I've been doing this work for 4 decades, and the most common complaint that I hear from people is that they don't feel like whoever is treating them is listening to them. They feel like either their concerns are dismissed, or their treaters are not accessible, or that there's not enough time when they meet with them to be able to really go through how are things going. And the other thing that I hear frequently is that people feel like they don't have a say in their treatment. And there is an area in medicine called shared decision making, which on the face of it sounds like it's pretty simple. But there are many people who don't share that as a philosophy. It's like, well, the doctor tells you what to do, and you kind of do it. Um, as opposed to, let's figure out together what the best path is, and let's test it. And along with that is the clear admission of uncertainty, because it's always uncertain. You never quite know exactly what's going to happen. And so that's why it's so important that there's clear communication, working together, collaborating. The word that we like to use in the Dalton Center is not adherence or compliance. The word we use is concordance. Can you both agree on a path that makes sense, that balances the side effects and the benefits? And let's test it. Right? Test it together, measure it together. Let's see how it's going. And ultimately, it's your decision if you're getting benefit versus the side effects. And I think that needs to be respected deeply, right? And the other thing is a very simple question that I learned from the Institute for Healthcare Improvement. And the simple question is, what matters to you? And if you reflect on your own experience, and the listeners to this, how often has anybody asked you that in your treatment? What about this is most important to you? what
Yeah,
what
it's
are your
pretty
goals?
uncommon, it's
What do
true.
you want to
And
achieve? Are we doing the things that are helping you get to that point, right?
Quick break. Can you let us review on Apple Podcasts or the platform of your choice? It really helps us break the stigma around bipolarity. Let's get back to the episode. When you go and see someone sharing is the most important thing, but how can we help for what you're doing at the Bipolar Action Network as bipolar?
Well, I think, well, my colleagues and I collaborate with people from Cincinnati Children's Hospital because they have built 15 of these for complex chronic problems, both medical and even social. And they've had incredible success. The oldest of their networks is 17 years old, and they concentrate and focus on kids with inflammatory bowel disease, Crohn's, and colitis. And they have done amazing things with improving their outcomes. And they've grown to over 100 different clinics sharing their data. They have 30,000 kids in their network. That's the vision that we have. We want to be able to have tens of thousands, 100,000 people through the different institutions that we'll have. And in a sense, I think the way it can help is by gently challenging the people in the system where you're getting care. What are your outcomes? What are you doing to get better outcomes as a system? Right? What are you doing anything? And have you heard about this network that they're really doing everything they can to try to see if there's a way to get better outcomes, right? And as a gentle challenge and maybe as an education, we're easily findable on the net. We have a good website on it, and we have an increased number of places that are interested in joining. Now, one of the paradoxes, though, that's a paradox, it's an irony, I don't know, but this is not a study. This is not a study just to publish papers. This is an organization to get better outcomes. Now, part of it we may publish in all of this, but I become very cynical about the impact of actual publishing something. Does that really change anything? We really want to change the outcomes together. But part of it is that because it's not a study, we don't pay the healthcare systems to do it. The healthcare systems pay to be a part of it because they own it. And this is a completely different paradigm, right? I mean, it blows out anything. The other thing that we're trying to blow out is I work at Massachusetts General Hospital, very fancy place, number one psychiatry. Who knows? It's the metrics are wrong, but it doesn't matter. But I'm telling you this because nobody knows what I do. Nobody in my system knows what I do. I get no feedback whatsoever about outcomes, what I'm doing. Am I doing it right? Could I do it better? None of it. The system's not built for that. And there's a remnant, I believe, from psychoanalysis. It's a one-on-one and nobody knows what we're doing. We want to blow that apart. It's one-on-one and every visit adds to the data. Every visit is a learning opportunity and we share it so that we can all take a look and go, how's it working? And it's saying, hey, look, we have this proportion of people who are doing well. Great. That's terrific. This proportion of people are not doing well. What can we do for them? Right? And is the treatment according to guidelines? And again, it's not to beat people up and say you're not doing guidelines. It's like, well, if you do guidelines, do you get better outcomes? Right? Or if one place is using lithium more than another place and they're getting better outcomes, there's a learning opportunity. And let's constantly learn what's going on and look at the outcomes. Nobody does that. I'm telling you, nobody does it. And so we're trying to really change that and trying to have an impact so we can get better outcomes for everybody and have the shared purpose of what matters to people. And the last thing I'll say about it is that this is not patient-centered. This is human-centered. Every human involved in it, the clinicians, the researchers, it enhances the clinician's life to be part of something larger, to get feedback, to constantly learn. it helps the person and their family to try to get better outcomes in a collaborative sort of way. Uh, so really, that's the radical nature of what we're trying to do.
Yeah, feedback is key. Um, what do you recommend to someone who's diagnosed? What is the path to recovery, you think?
So the path to recovery is highly variable, right? Everybody has a different path. Now, part of that is, it's probably not one disorder, it's probably multiple disorders, bipolar disorders. The other thing is the co-occurring things that people have with it that sometimes can make it harder to get to recovery. Um, the good news is that when people are in distress, either because they are in the middle of an episode or not, for most people that tends to be time limited. The difficulty for many people is it comes back. The other difficulty is that even when it's time limited with treatment, um, there can be other symptoms that don't go away. One of the things I've been worrying about is people still have trouble sleeping, right? Even though they're better, then they're tired, and then it's hard to function, or they're anxious. And what do you do for the anxiety, right? And these are things we actually don't know, right? It's we don't know exactly what to do, which is why I'm really eager. We're just starting to get the data now from the network to be able to learn from other people what's actually worked, right? What's worked for you and what's worked for whom, and can we personalize the treatment as much as possible?
One last question. If you have a magic wand, yeah, or
I
if you
can
have a
sort of
magic
hear it.
wand, I will use a question. If you have a magic wand, what would you change in one else?
If I could change one thing, or if I had if I can change one thing, if I could change one thing, um, I think that one of the things that would help people tremendously would simply be systematic diagnosis. And rather than, it depends on who you see, depends on what they do, it's highly variable. The questions they ask might be variable. People have different thresholds. If you just had a standard way to do it, and there are standard ways to do it, and in our network, we have people who are testing that, right? If you just had that in a system, you wouldn't make errors of diagnosis, right, where it takes 10 years to figure it out. You would also avoid errors of overdiagnosis. I see people who, well, I was depressed and I felt irritable, so they said I was bipolar. It's like, really? It's like, that's not it. I get that a lot, right? And it would just avoid all of that. And essentially in our field, it's not the tradition, right? You don't do that. You get the narrative and you figure it out. It doesn't work that well, and that's why there's such a gap between first symptoms and when someone's finally diagnosed. So I think if we close that gap, that would help a lot. And the other thing is, if we measured what we treated and made it transparent, right, I think that would also be helpful.
To learn more about Bipolarity, go to our website upstage.com, HOPESTAGE.com. See you soon.